Good afternoon, everyone. I want to thank you all for being here today for this important discussion on how can we better support mental health on campus. I'm Liz Thomas. I'm an assistant professor in the Social and Behavioral Sciences Department here in CPH, and I want to welcome you all on behalf of my colleagues here. As we all know, and as we're going to hear about more today, mental health is a critical factor in student success, retention, and overall well-being. And colleges and universities across the country, including Temple, are working to address the growing and evolving mental health needs of students. Today's session is going to bring together experts in research, university policy and programming, and peer support to explore innovative strategies that can enhance mental health supports on college campuses. We're going to examine both existing initiatives and new possible approaches, including non-clinical supports, peer-led interventions, and systemic changes that could promote student wellness. I'm joined today here by a distinguished panel of speakers, including Dr. Mark Salzer, who is Professor of Social and Behavioral Sciences here in CPH, Mark Dins, who is Temple's Associate Vice Provost for Health and Wellbeing, and Matthew Federici, who is the Chief Executive Officer of the Copeland Center for Wellness and Recovery. I want to thank all of you for taking the time to share your expertise. And I'd also like to extend my gratitude to Dean Ibrahim and Senior Associate Dean Sarwar for making this session possible, and of course to Kim Wing for her invaluable logistical support. Following our presentations today, we're going to open the floor for a Q&A session. We have designed this as a meeting that will enable you all to share comments or questions in the chat, as well as to unmute if you'd like to speak. We really want to make this as interactive as possible and invite you all to share your perspectives and explore actionable strategies for enhancing student mental health at Temple and beyond. Once again, I want to thank you all for being here, and we're looking forward to a thought-provoking and productive conversation. To start off today, our first presenter is going to be Dr. Mark Salzer, again, who's professor in the College of Public Health. Dr. Salzer is also the principal investigator and director of the Temple University Collaborative on Community Inclusion. This is a federally funded research and training center dedicated to promoting community participation among people who experience psychiatric disabilities. Dr. Salzer is going to provide an overview of mental health challenges among college students, their impact on academic performance and retention, and introduce us to some non-clinical approaches to supporting students, including peer support initiatives. So I'll hand it over to Dr. Salzer.
Great, thank you, Liz. And it's like Liz said, it's great to see so many wonderful colleagues and other folks who have made it today. So hopefully you can see my my title. Liz, just give me a thumbs up, or I think somebody did. I'm just going to give a little bit of a basic introduction to our topic and start to explore with everybody some of the non-counseling or non-clinical approaches that can be taken to support college students with mental health issues, and especially around supporting the academic success of these students. My initial interest in this area began about, I hate to admit it, about 25 years ago, when I began to be interested in the employment experiences of people with serious mental illnesses, people diagnosed with schizophrenia, spectrum disorders, bipolar disorder, major depression. At the time, there was a lot of talk about mental health as being the primary reason why these individuals were not having good employment outcomes. Unemployment rates were incredibly high, job turnover was incredibly high, and really the idea at the time was that it had something to do with the mental health symptoms and diagnosis that people experienced, and that's why people weren't working. In some of the work that I was doing, I started coming across, however, the common factors that impact people with serious mental illnesses that also impact the general population, the factors that influence employment. And some of the biggest factors that impact employment outcomes are actually gender, age, race, ethnicity, and educational attainment. And it's really that educational attainment that got me most interested at the time and really helped me take off some number of different studies that I've conducted since to really explore this area. At that time, 25 years ago, there wasn't a lot of research looking at the percentages or numbers of people with mental health issues who are on college campuses. At the time, the numbers seemed to be relatively low. And here you see on this slide, looking at more recent data from 2020 to 2021, 60% or more of college students met criteria for at least one mental health problem, according to one large national study that happens annually, I believe. Also, in another separate study, nearly 75% of college students reported moderate or severe psychological distress. For me, in some ways, this is very exciting data. At the time, 25 years ago, students, high school students, and others were really discouraged from going to college and seeking higher education because the idea was they couldn't handle it, they couldn't handle the stress, they wouldn't be able to be successful, their brains didn't work right, they couldn't think straight. And these data I find incredibly encouraging that there are college students with mental health issues on campus. But having said that, we also know that there are challenges for those students related to academic success that are really important for us to address. A lot of focus has really been paid to the impacts of these increasing numbers of college students with mental health issues and their use of counseling centers. And Mark can certainly talk or will be talking about this in a lot more detail, but there was a terrific book that came out about 20 years ago called College of the Overwhelmed. And this book really talked about the growing numbers of students with mental health challenges and how this was really overwhelming college counseling centers and making things very difficult for them to really meet the needs of students on campus. But the fact of the matter remains that most students with mental health issues on college campuses do not seek counseling services. They do not seek mental health services for a variety of reasons that we could talk about later if you'd like. And this phenomenon actually led me to really try to explore other kinds of ways we can support the academic success of these students while hopefully they're seeking mental health services for the symptoms that they're experiencing. What could we do as colleges and universities to support academic success beyond referrals to counseling centers or mental health services? One of the studies that I've done in this area is to try to look at the types of impacts that mental health symptoms have on educational attainment and academic behaviors, especially things like procrastination, not studying, not completing assignments, not making it to class, self-efficacy, feeling like students with mental health issues, how confident are they in completing their assignments, in being able to graduate, to successfully interact with other students or faculty or administration. And we actually found that students who experience higher or more symptom distress related to mental health issues had more challenges in all of these areas. Greater psychological distress was associated with more procrastination, completing term papers, studying for exams, completing assignments, and they also experienced lower self-efficacy. certainly one implication of this is to try to address those symptoms, right? Through treatment of some sort, maybe medications, therapy, counseling, those kinds of things. But it also suggests to me that we know that there are issues that these students are going to be experiencing immediately related to their academic behaviors in these areas. And one strategy that we could offer is coaching and counseling and supports to help address procrastination and hopefully enhance self-efficacy around their ability to complete their studies and complete their courses. So it doesn't necessarily need to be a clinical or a counseling intervention. There are other kinds of things that we can offer as well. This is actually consistent with a type of program that unfortunately isn't very common across the country, but in my field, or one of my fields, psychiatric rehabilitation, there has been a lot of work in the area called supported education. It's a type of supports model that really is intended for individuals with significant mental health issues. Actually, Matthew, seeing you, I met Matthew Federici when he was running one of these types of services a number of years ago. These supported education models really focus on academic skills, seeking supports and resources, getting help at the counseling center, going to disability resource services, making sure that they're not procrastinating, making sure that they're getting up and going to class and doing these kinds of things. It's not therapy. It's not necessarily clinically focused. It's about supporting students kind of in the here and now while they're dealing with their mental health issues to be able to continue and be successful in their academic pursuits. And this is a promising practice. It's not quite an evidence-based practice, even though sometimes I think it should be considered an evidence-based practice. It's not often used. New Jersey actually has invested heavily in supported education throughout the state at various universities. Another area that I've been interested in as well is the concept of campus engagement. There's a framework called the Tinto model that you see here on this slide. Basically, the point of this perspective is that it's not that academic success, performance, retention isn't just due to academic preparation or intentions to be successful or those kinds of things, that the extent to which students are engaged on campus, are attending sessions like this, are going to basketball games, going to the library, going to class, interacting with faculty and other students and administration, joining an organization or a club, that these campus engagement factors have been found to be predictive of retention and performance for college students in general. And there are some initiatives nationally that really pay attention to campus engagement as a primary factor. How do we get students engaged? And as a result of that engagement, we would see greater motivation and greater academic success. One of the things that I've looked at, however, is to see if for some reason students with serious mental health issues are less engaged on campus, and that this could be another reason why their academic success is more challenging for them. And the research that I've done in this area does suggest that college students with mental health issues are less engaged with campus facilities, again, going to libraries less, going to the dining hall, doing other kinds of things than other college students. They're less engaged in clubs and organizations. They're generally less satisfied with their college experience and their relationships with other students, administration, and faculty. So it seems that for some reason, and actually I know one of the reasons that's also reported in this study, those students with mental health issues who experience greater levels of stigma on their college campus were less likely to be engaged. Students who said that they're more likely to feel like they're treated differently because of their mental health issues on campus were the ones who were especially less engaged on campus. this suggested to me that an intervention aimed at enhancing campus engagement could be successful in some ways and could hopefully lead to better outcomes for these students. So we were able to get a study funded here at Temple University where it was a study looking at a peer facilitated intervention aimed at enhancing campus engagement. This was for college students with mental health issues. We didn't talk about clinical issues. It wasn't about symptoms. It wasn't about those kinds of issues. It was how can you be more engaged on campus? And that's what the focus was. It was a 2-semester intervention, somewhat intensive. And we have actually just looked at the data recently at the results and found that those students who were engaged in the intervention had greater autonomy, self-determination, greater sense of social support. They reported higher levels of flourishing, or that's one type of measure of well-being or wellness, greater college self-efficacy. They reported better study habits, less procrastination, and overall, they reported a greater sense of belonging, which can also facilitate retention and greater performance. So those were some of the studies that I wanted to mention that I've been involved with that hopefully have you thinking creatively about a lot of different things. We are very fortunate to have an outstanding counseling center. I am fortunate to be able to do presentations around the country. People literally come up to me when they see I'm from Temple and they go, the Tuttleman saved my child's life and kept them going in school. We also have a fantastic Disability Resource Services department. Carrie Snyder is amazing, do great things, but there are lots of other things that we can do as well. I wanted to, we're talking about wellness in this webinar today. I did want to draw your attention to a document that one of our Temple students did as part of their public health assignments. Ariana looked at wellness initiatives around the country and pulled it together into this compendium. I'll try to remember to put this document in chat, but I think she found, 300 plus different types of wellness initiatives that are happening around the country at different colleges and universities. Again, for me, this is just a way for us to explore and be creative about the different ways we can promote wellness and academic success for students at Temple University and other universities as well. And finally, today we're also talking about peer support initiatives. This is another area that I've worked in for a long time. I believe peer support, people with mental health issues supporting one another in a lot of different important ways is an evidence-based practice. I think we have ample evidence indicating that. I was fortunate to be able to be involved and provide some guidance on a national survey looking at peer support initiatives that are happening on campuses across the country. And we learned a lot with this. We found out and we know that peer support initiatives are growing across college campuses. We also know that there's a difference between the activities of peer support initiatives that are fully led by the peers themselves, the students with mental health issues, versus initiatives that are really led by staff members, by non-peers. They focus on different topics. Maybe that's a good thing. Maybe there's some activities we want to focus on more than others, but that was one of the interesting findings. And related to that is we found that staff-led initiatives were more focused on navigating mental health services, and student-led initiatives were really more focused on well-being, study skills, mentoring, college success, those kinds of things. And it gives us some ideas directions that we can take in addition to the outstanding supports and services that are already being offered at Temple, certainly, and hopefully at other universities as well. So the last thing that I'll put in chat is our website. I did put our website in. We have a lot of resources related to supporting education and academic success, and I welcome you to take a look at it. And you can always send me an email, but most of you here probably know how to find me. So thank you very much. I'm going to pass it back to you, Liz.
Thank you so much, Mark. I wish we had more time to hear from you about all of these different initiatives and studies, but yeah, I would encourage you all to check out the TU Collaborative website to learn more and to contact Mark directly. So our next speaker is Mark Dens, who again is Temple's Associate Vice Provost for Health and Wellbeing. Mark oversees the Student and Employee Health Services, Tuttleman Counseling Services, and the Wellness Resource Center. And he's going to highlight the many mental health and wellness initiatives currently in place at Temple to support students.
Thanks, Liz. Is my PowerPoint showing? Okay, good. Thanks a lot, and thank you everyone for giving me a few minutes today just to share all of the different initiatives and programs that are available for students at Temple. I'm going to talk primarily about things that are part of the Health and Wellbeing Division, but I'm also going to mention some things outside of our division because we can't do this alone and we don't provide these services alone. So I'll talk about some things from whether it's student affairs, IDEAL. We work with a lot of the folks on this presentation today, a lot of folks in the College of Public Health. So it really is a team effort amongst many people throughout the university. But I am going to primarily focus on the things in the Health and Wellbeing Division, which doesn't want to start. There we go. All right, so I'm going to talk about Tuttleman Counseling Services, the makeup of the department, what type of staff they have. They do have 5 clinical leadership. They split their time between administration and clinical. We have 22 full-time clinical professionals, 4 psychiatrists. The remaining are split between doctor-prepared as well as master-prepared clinicians. And then we have a very robust training program. We have full-time pre-doctoral interns. It is an APA accredited doctoral internship. We also have postmaster's fellowships. This year, they are 3 post-fellow doctoral students, and then there's 1 master's of social work. So we're getting master's of social work post students as well for the fellowship. We also have doctoral interns, master's level doctoral externs, master level interns, as well as some other undergraduate interns. Wellness Resource Center, talk a lot about their staff. They have 6 full-time coordinators, 3 of whom are in mental health related content areas. 1, mental health well-being, interpersonal violence, and the 3rd being alcohol and other drugs. We also have 46 nationally certified peer educators that do a variety of programming, and I'll talk more specifically about that programming a little later in the presentation. Also going to mention the care team case managers. They're part of the Division of Student Affairs. They do a lot of work with students who are either at risk or maybe they were having a hospital stay and they're being discharged. They're following up with different academic issues, but the case managers for the care team really do a lot of work as well. A couple things about Tuttleman Counseling. We now have 2 offices. The second is up on the health science campus. That's relatively new. That was been open for about 1.5 years now. It's in the Student Faculty Center, and it is a integrated health center, more or less with student health. We still have separate medical records, but we're in the same space, sharing the same facility, so students can come there for health-related or mental health-related issues. And then here on main campus, 1700 North Broad, we're on the 2nd floor of that building. You can see our hours in our website there. Another thing I want to highlight that is new for Temple, we are a JED campus. We started our relationship with JED a few years ago. We're now in year 3. So JED, for folks who aren't familiar, they're a non-for-profit. They focus on really K through higher ed in terms of trying to help schools and colleges develop their mental health resources, and then they give a variety of different resources available to other students. We have access to the Healthy Mind Survey, which we deployed in February of 23. We'll be doing so again in I think it's September or October of 25. So this fall, we'll be deploying that survey again. That was where Mark had a few of his statistics were taken from that survey. So we've done that here on Temple's campus, and the results are very similar to what Mark presented. We know that our students who participated in the survey, 39% did screen positive for moderate to severe depression. 34% moderate to severe anxiety. So we know that the challenges that college students are facing throughout the country, where they're also facing here on Temple's campus. We are not unique in that regard in any stretch. Couple of things in year one were that survey. We did a couple other baseline assessments. We put together our strategic plan. Year two, we focused on 4 primary areas, putting together a communication plan with social media, revamping websites, really trying to get some of the digital tools around campus to utilize those to get the words out about the different resources we offer. It's been one of the challenges, trying to get students to know about our resources at the time they need the resources. So it's something we're continually working on. Social connectedness, also related to that, trying to make sure the students are feeling that sense of connection and community here on campus. We also looked at our leave policy, medical leave policy, and reviewed to make sure that is meeting the best practices out there, as well as our suicide prevention and postvention plans. Part of that, or subsequent to that, we did become a certified suicide prevention school within Pennsylvania. So we've been recognized within the state. We're one of only 7 other 4-year universities to receive that designation. So they've looked at our plan, and we have a really robust postvention plan for when that unfortunate event happens. Now, year 3 is really monitoring. We are very fortunate. We did a lot of the things that many schools haven't yet gotten to do. So when we went through our assessment phase in year 1, there weren't a lot of gaps in what we were doing. So we're really fine-tuning the things we're doing, reviewing things that we're already doing. So there hasn't been a lot of things that we've had to add because of the great work that Tuttleman has done, the WRC has done, and other entities around campus have done prior to this relationship with JED. So a couple of the services and more specific things and the organization of the different resources that are available for students. So things in Tuttleman counseling, we really run the gamut of services. You know, we go from less intensive services, therapeutic yoga. We have a Let's Talk program that is a drop-in consultation. We really try to focus that in different areas on campus, go out to meet the students where they are, specifically in areas where students may be less likely to seek counseling services. So they're not counseling sessions, but they may lead to counseling sessions. So it's a drop-in consultation meeting. And we have sessions in IDEAL, International Student Services, Disability Resources, as well as the Wellness Resource Center. So again, trying to offer students something different, offering the service outside of the counseling center to hope that more students may take advantage of those sessions. We do skill-based groups, a lot of different things, developing skills for anxiety, stress, depression, just trying to help add to the coping skills that students need to successfully navigate their time here at Temple. We also have process groups, which are more of the grief relationships. There's different groups on campus that are specific with graduate students. We have a Black student support group. So there's a lot of different groups there as well. We also have psychiatry. So psychiatry does evaluations, medication management. They can work with our counselors who are doing the short-term individual counseling. And then we do referrals and case management. One of the other things I want to highlight is crisis consultations. They're available same day, immediately. So if a student has an urgent need, they come into or call Tuttleman Counseling, they're seen immediately. We have several counselors who their schedules are blocked every day in order to meet the needs of the students that walk in for these crisis consultations. Some of the things that the Wellness Resource Center offers. They have a lot of well-being workshops on a lot of different topics. Some of them can be mindfulness, stress related, how to deal with stress, kind of really emphasizing some of the things that Tuttleman Counseling is already doing as well. Um, they also do suicide prevention, gatekeeper training, or QPR training. They do that for students as well as employees. And they do offer multiple sessions throughout the semester. They also do Change Talk, which is our brief motivational interviewing class, also available for employees as well as students. I'll also mention student health services. Student health sees a large volume of students. We'll see anywhere from 100 to 200 students every day. We do screen for depression using the PHQ-2, and if they screen positive with that form, we do the PHQ-9 depression screening method. Every student, we try to make sure we're capturing them at least once a semester. We do have a lot of students that come in every week, every couple weeks. So we're not screening them at every visit, but we want to make sure that we're at least doing that once a semester. And then student health will, if they screen very high, they may walk them down to the counseling center, and we have a process in place for that. Or they may just refer them to the counseling center, or a lot of times they may refer them to some of those less intense services, some of the well-being workshops that the WRC offers, maybe therapeutic yoga, make them aware of where the Let's Talk sessions are. So maybe they can drop in there and learn more about what can happen during some of the more intensive groups or short-term individual therapy. So we really try to meet students where they are and adjust things based on what they need and what's going to work for them, because not everything works the same for each and every student. So this is same type of services that I just laid out, kind of in a stepped care model. We like to refer to it as our flexible student-centered care, because care is not going to look the same for every student. It really depends on what is working for that particular student and what that student is looking for. So some of the common reasons for coming to student health, most of these should not come to much of a surprise. Anxiety and depression, those are two of the biggest. We also see folks for relationship issues, as well as a whole litany of other issues. Any mental health concern that folks are, have on the outside of a college setting, they also have here. And they come to Tuttleman Counseling for all those different things. So what does individual therapy look like? As I mentioned, it's short-term individual therapy. We typically don't do long-term. I say that at the same time as saying 5 to 10% of our folks will stay in long-term because that's what's best for them. They may not have resources to be referred out into the community. The average number of sessions is 4 to 6. So we do have some that are seeing more than 20. We have a lot who are seeing maybe once or twice. The average winds up being 4 to 6. We do not have session limits. That's one of those kind of temple urban legends out there, urban myths. Students feel like there's a limit to the number of sessions. We do not have session limits. It just happens to be that most, the average are 4 to 6. And then psychiatric care, as I mentioned earlier, we can have a psychiatric evaluation, do medication management. We also typically have 1 to 2 fourth-year psychiatry residents from the Temple Health System residency program. During their third year, they do outpatient psychiatry. Their fourth year, they get to choose. And we're very fortunate that many of those psychiatry residents choose to spend a day or two a week in Tuttleman Counseling. So that's another supplement to the staffing on the psychiatric end of things. So some of the recent things, I've mentioned some of these, but I'm going to highlight them a little bit more. The new HSC Integrated Health and Counseling Center, that was a long time coming. I've been at Temple for about 20 years. I think I've been trying to get a counseling center on that campus for about 15 of them. So that was a real long time coming. So that's been a great addition for the med students, pharmacy students, dental students, as well as a lot of college of public health students who go to that campus on a routine basis. We have full-time therapeutic yoga at this time. Let's Talk, I've talked about a few times. The technology, I'm going to talk more about that in a second. That's something I'll take every opportunity I can. We don't have a wait list. It's another one of those Temple urban legends out there. There is no wait time to see a counselor. I mentioned the crisis counseling, that's immediate. But for folks coming in for routine counseling, they are seeing same day, next day. I think there's been one day in the last year and a half that it went to 2 days out, beginning of the semester, and we were just super busy during that time. But that was one day in the last 18 months. So we have no wait time. Students are seen same day, next day. If they come in, maybe after 1 o'clock, they may be seen the next day. Usually, if they come in before 1, most days we'll get them in that same day. Saturdays, they will have to wait till Monday. So I should say the caveat is it's business days. One other thing I'm going to promote, and I know Andrew Lee is on this call. He's the director of the Counseling Center. Andrew, I'm not trying to jinx this, but Counseling Center is fully staffed. We've been fully staffed for about 6 months now. That's never happened in the 20 years I've been at Temple. So that's a huge credit to Andrew and his team. And that just enables us to provide more services when we're not recruiting and we're not trying to deal with turnover. So that's been a fantastic thing. And I swear I'm not jinxing it. So a couple of the technology items that are relatively new over the last couple of years. So WellTrack Boost. This is something that's free, available for students. It's an online self-directed app. There's a couple different things in there. There's some wellness tools, some surveys. You can take a survey. They will then give some resources and suggest some different topics that students can take on their own, and students can read and participate on their own. There's a Zen room, which is to assist with meditation. So that's a really great resource for students. This is also available for employees for free as well. So you can take advantage of that, although I'll advocate for the Calm app that we now have available too, but I'm sure everyone on this call has signed up for that at this point. And I'll try and put the link for that in the chat in a few minutes. TogetherAll is the second technology app that students can access for free. This is a peer-to-peer mental health support community. So several, tens of thousands of students throughout the country all participate in TogetherAll from different colleges and universities. If there's a group out there, left-handed students who are feeling depression, there's probably a group in TogetherAll for those folks. Like I said, there's tens of thousands of students. They offer a lot of different things within that app, journaling, goal setting, some self-assessment tools, but it's primarily like a Reddit, but specifically for mental health issues with college students. And one thing I will say, confidential, everything at the Counseling Center, as well as the Wellness Resource Center now, is confidential. So we are not mandatory reporters. We're exempt from that process, except for a few exceptions. If the student is a danger to themselves or others, if the student gives permission, if there's suspected child abuse or elder abuse, or if we have a court order. But other than that, we are confidential. We follow HIPAA. We follow the mental health privacy laws. So we do not share things with parents unless specifically the consent is given by the students. All right, that was a lot in a short period of time. I will turn it back over to Liz, and then we'll be available to answer some questions in a few minutes.
Thank you so much, Mark. Hearing about this really robust set of supports and services that we offer at Temple, I think makes me all the more honored to be a part of the Temple community. So it's really wonderful to hear about all of this. So our next presenter is going to be Matthew Federici, who is the CEO of the Copeland Center for Wellness and Recovery. Matthew is an internationally recognized expert on recovery, wellness, community inclusion, and peer support. And he's going to be introducing us to Taking Action, which is a peer-facilitated wellness self-management program. We're currently studying it at Temple. And Matthew's going to share a bit about what Taking Action involves and how we've adapted it to support college students.
Thanks, Liz. Thanks to Temple University, to say first off, very exceptional university just to even have the people that are here today given time to this topic. Unfortunately, it's not a more widespread practice, and it's very difficult to get the level of attention to this topic that you all are given. So I want to special thanks there. I do also have to thank Temple because when I was in an undergraduate degree, I threatened my private school with, if you don't give me more financial aid, I'm going to leave and go to Temple. And that yielded some good results. So almost landed at Temple, but you still contributed to my journey. So my name is Matthew Federici. I'm the CEO of the Copeland Center for Wellness and Recovery. I've been here for 15 years. The organization's been around for 25. We're a peer-led, peer-run organization. And I think it's important to clarify by that, meaning that all the people that work here, our board of directors, myself included, come from a lived experience, an inside-out perspective on this. And I really do have to thank Dr. Salzer in the path that my career took. As he mentioned, I worked doing supported education, supported employment, residential counseling. I worked in the public mental health sector and really found a great disconnect between what we were doing and what we were trying to help people move towards. And as Mark kind of discussed, people needed opportunities to participate in the community like everyone else. And oftentimes it was barriers and lacks of support to stay engaged in community that really resulted in the severity of the mental health challenges that people had. As a notable colleague, Dr. Bill Anthony said, is he recognized years ago that the chronicity that we see with people with mental health conditions, the result of those conditions or the system we created for them, right? And indeed, it's from my experience, it's really the system we created for people who are really identifying with those deficits and oftentimes discouraged from going back to school, going back to work. Dr. Salzer's work, he was really documenting things like, consumers operating as providers and the legitimacy that people with lived experience had in being able to connect with and help other people and coach other people through living with those challenges and getting back into the community. And his work is focused around the importance of employment, importance of education, and the role that peers and people with lived experience had, which really encouraged me to kind of hang up my clinical training and background and really kind of go all in on the fact that I knew that people can and do recover, and I knew things from the fact that that was my experience. And actually, education was really literally something that saved my life. It was a key action plan for me through some very difficult times, institutionalization included, but it was really leaning into education that got me through, it got me to stay well. So I want to talk today a little bit more specifically about taking action, which is a particular approach that brings all that together, an approach that we're doing and collaborating with Temple's Collaborative and Community Inclusion around, because it's an intervention or an approach that is based on peers sharing together, working together, and has been successful for nearly 30 years. And there's a great potential here to be supporting people where a lot of times our mental health challenges really start to surface, and that is in our transition age, that is in the college environment. My personal experience is that the severity of which people experience mental health difficulties is measured to the supports and the resources they have at a time of emotional crisis. That when people are having those emotional crises or breaks or overwhelm points in their life, it's not a matter of an internal biological thing that ticks off. It's really a matter of a person reaching out to get through that, and to the degree in which they have something to grab onto. And that is social supports, listening ear, the therapy that they need, et cetera. And so I don't think there's a more critical time to change the trajectory of particularly suicide rates than to have programs and resources like Mark Denny shared available to people and making sure they're getting them during those college years, not just in saving lives, but actually for me, the turning point, it can be that people achieve great success when they get the resources they need at the right time that they need it, right? Which is why we want to make sure they're accessible. So taking action for whole health and well-being is a program that has been developed over the course of about 30 years. A lot of the curriculum and input and research that has been built into this structure was done when working with SAMHSA and that curriculum is continuing to be updated with current research. This program is a program that comes from the perspectives of individuals with various mental health and other health challenges, where 30 years ago we came together to seek what actions we could take to improve our own personal quality of life. Many of us were not getting anything but kind of maintained, sustained, stabilized, and even in sometimes getting interventions that were not working and nobody was listening to us. And so this work came from those groups of people coming together and saying, what can we do? What's in our control to take action to improve our situation? The approach is a co-facilitated group process that supports individuals in creating a personalized system for recovering, sustaining, or improving their whole health outcomes and enhancing their lifestyle. So we can't separate our mental health from our multiple other domains of health. And so we don't. We focus in on all our whole holistic selves. And we take an approach where each individual in the group, in the mutual learning group, is applying the different structures to an individualized system for themselves. So the objective of this group intervention is to identify foundational concepts to building personal resiliency and facilitate well-being, apply personal wellness tools related to whole health and well-being, develop wellness tools and a personalized strategy for action planning and whole health and well-being. The important piece is the approach to this is an inside-out perspective. No one's giving anyone advice. No one's telling anyone what to do. It is heavily based on each other, taking open a topic and exploring that topic together and sharing what we have learned and figured out for ourselves. A little bit about the structure, though. There are critical concepts that are explored in depth as a foundation. The approach is an approach that each section of the curriculum builds off the other. But the real application of what we talk about comes from people's lived experience. People learn from each other around those things. So we explore the importance of self-esteem. We explore, for example, what our experience is with self-esteem. How do we feel? How do we feel and personally rate our own self-esteem? What are the factors that contribute to that lowering our self-esteem or raising our self-esteem? We talk about the importance of hope. But again, really the importance is, how would you define hope for yourself? So this is not an outside in where we're telling people this is what this is what you need to do, but rather we open up what we have found over the course of 30 years through kind of a qualitative analysis of all of our stories. These are the important concepts. And for the sake of time, rather than exploring all of those, I'll just kind of list off that we go through the importance of education, which is not just institutionalized education, but lifelong learning, empowerment and self-determination, self-advocacy, building a strong support system, community inclusion, and connection. And community inclusion has become a more and more important topic for people because we don't get well by putting our lives on hold and then going back to school and then getting into a relationship and then going back to work. But actually, it's those actual things that we use to be well, to stay well, and to get well. That may seem like common sense to many of you, but by and large, if you're entering the mental health system, what's happening is you're being told to put those things on hold and then go back to those things. Couldn't be further from useful. And then again, connection. And I think many of us, many of the people in the world understood how we're on a spectrum of mental health during the pandemic, in particular when it came to the experience of connection and disconnection. But indeed, the research has kind of been more overwhelming that more the root cause of addiction, more than anything else, is disconnection. And so in our work as a broad range of peers with lived experience, addictions is a domain of that. And an important concept that comes up is connection. How do we find connection? Connection to self, connection with others, connection with the environment around us, because it's a major contributing factor to many of our experiences with addiction. as well as disconnection. So these are all critical elements that are explored in a peer-facilitated approach. Once we kind of orient ourselves to how those concepts are applying or not applying to us and how we may or may not operationalize them in our lives, we get into a thing we call the wellness toolbox. And I was afraid this was going to happen when I did this view, but let me see if I can grab my more participatory question here. All right, I just threw a question in the chat for you to consider. You can throw something back in the chat if you'd like. And that question is, during the pandemic, did you find yourself connecting with a personal activity, resource, or a thing that helped you deal with the stress or disconnection that was happening? Can you share what that wellness tool might be? And so please just feel free to throw that in there. And if you do, what you'll be doing is a little teaser into one of the things that we do in the peer group, which is we explore wellness tools. Those things that empower us to take action on our own behalf. They're simple, safe, and accessible. Like, they're things that we can always do for ourselves. As silly as it may be, I've just recently got into buying actual popcorn kernels and making popcorn and creating my own seasoning, and just went through a rough period where everything seemed really stressful, dark, and I was starting to lose hope. And the best I could do was just make some popcorn and watch Murders in the Building with my partner. And, you know, we're kind of bringing back, and with the research around our approaches around this, is really kind of breathing back into the validity and the powerfulness of these simple things that we can do. And these are called wellness tools, right? But we don't just leave that there. Thank you all for throwing in these great ideas. And I always find that it's just energizing when people are sharing this with each other. But you're getting kind of the idea, reading some in the chat groups, like, oh, you might look at something and go, that's a great idea. I haven't done that in a long time. I really should, right? And this is why what's important to this intervention, if you will, is that it is energized by people sharing together. It is not done in isolation. These topics aren't done in disconnection. So from there, as people are learning from each other and building this wellness toolbox, the next part of the program is the action planning for prevention and recovery. So nobody knows how you're supposed to line up those wellness tools with the right time and place. You know best when you're going to apply that. But what we can do is start taking a look at also some individualized experiences that when they happen, you can pull those wellness tools out, and rather than react or disconnect, you can use those tools to stay well through that process. So it, again, is an individualized approach. Only ourselves can develop these action plans. Only we know when we're going to apply them, how we're going to record and store it, how we're going to remind ourselves to use those wellness tools in those moments. The intentionality is that we're doing these action plans to improve our ability to identify and communicate effectively with our supporters. So that's another element here. Only we know when and how and who is actually going to support us at the right time and what we may need them to do, right? A lot of what Mark Denny shared shows the Temple has a lot of available resources for people to pull on in their wellness toolbox while they're on the campus, right? Yoga, meditation, these apps. So what we're doing in this approach is calling those things out. We're putting them into a toolbox. And then we're going through directly addressing the feelings, behaviors, and circumstances most troubling to us, where we can apply those action plans in a systemic way. And knowing that we can do this renews our sense of hope that things can and will get better, and that we have control over our lives in the way we feel. A good friend of mine once, I think, described in their way what hope was, and that was, whatever problems arise, I may not know what the solution is, but I always know there is a solution if I can just get access to the right information to figure it out, right? And to me, that's one way we can define hope, is knowing that there is a solution to whatever problems that are occurring. We can accept we may not know what that solution is at the moment. And one of the great things is we can develop these wellness tools and action plans and keep trying a different thing until we figure out what that solution is going to be to that scenario. So This here is what you see is the action planning process. We start with a daily maintenance plan. And the first part of that is describing what we're like when we're well. To me, this is revolutionary because in both my academic and my personal experience in the field, we never ask ourselves how we define wellness in our life. I honestly define my mental health wellness as an absence of ever being depressed or ill again. But that would be like having a definition of physical fitness as just not being physically ill, right? And so we start off with our own vision statement of what wellness looks like for us. And that description is for yourself only. And then from there, we think about what we need to do every day to support that experience of wellness. I look at wellness as episodic. I want more and more frequent and longer periods of wellness. It is not something I just wake up every day feeling well. It is something that takes intention, right? So again, I invite you, if you want in the chat, to share, like perhaps during the pandemic, when everything changed for you, did you find that you developed new daily routines and have to define what wellness would look like for you in that environment? Right. So the pandemic created an environment where we all experienced somewhat of an emotional, social crisis. And that's what it's like for many of us for other reasons with mental health. And this is why the daily maintenance plan is a critical piece to this, which is I got to figure out now, what am I going to do every day? So certainly share in the chat box if you had a new routine that you found you had to do every day to stay well through the pandemic. I know it should be a wellness tool every day, all the time, to wash my hands frequently and not touch my face. But during the pandemic, it became a really powerful wellness tool to staying well. We go through the rest of it keeps building on it, which is we go through discussions around early warning signs. What are those subtle signs that when they happen, we need to take action, right? I just recently had somebody near and dear that I loved was having early warning signs for a while and didn't take the action plan of going to the doctor and figuring out why they were becoming gradually shorter and shorter of breath. But this is an early warning sign, but that early warning signs can get to when things are breaking down. Shortness of breath, as you know, can be an indicator you're heading towards a heart attack or something more severe. And so this is the same way with our mental health. There can be earlier signs we can recognize. I kind of skipped over one, which is triggers. And triggers you can call them whatever you want, but this is just recognizing we all have individual circumstances in our environment that when they happen, they can really cause a setback or they can really cause big feelings. And I know for me, for many years, I just lived by reacting on those triggers. And only to the point where those reactions wouldn't work anymore and were causing problems for me, right? But I realized even though I got past that, it's still effective to constantly evaluate what those circumstances are that give rise to conflicts for me internally, can cause setbacks, and have action plans when they happen. Something as simple as rush hour traffic, right? Not a good time for me to play Metallica. Maybe it's a good time for the WRTI jazz station, right? So sometimes we could do the opposite. We can do things that are only going to inflare those triggers more. This progresses into then thinking about what we all don't like to think about, which is when we need to hand over control to people that care about us. And that's called crisis planning. And that includes medical, but otherwise situations where normally I take responsibility for this, but in this situation, I need family members to step in. I need medical professionals to step in, et cetera. And then there's advanced directives, which are at times when treatment decisions need to be made for me, and I have no capacity to communicate. So we even go as far as, even in that situation, you can still have power and control by thinking in advance. For example, and I think this is not just for people with mental health conditions, but how many people here, and you can share by chat if you'd like, already know that if they should ever be in a psychiatric crisis, you already know that you would not want them to try electric shock convulsion therapy, right? ECT, right? If you already know that about yourself based on your own level of education, this is something you might want to put in an advanced directive, and don't bank on the fact that, oh, well, I'll never be in that category. If you know that about yourself, put it in your advanced directive, right? Like I have in mind, I don't ever want ECT. That is something you should have a choice around. So this covers what taking action is about. I'll let, if there's some time for Liz to talk about how we're implementing this in the study, I'll kind of leave it there. You can certainly get in touch with me or go to our website to find out more about our programs. You can read more about taking action. You can reach out to me more. I can come and do more of a presentation to your colleagues and others. So thank you. Wish I had more time, but hopefully that gives you a gist.
Thank you so much, Matthew. And I'm going to be very quick. Instead of giving my talk, I'm just going to share in the chat our study flyer for our Taking Action study that we're doing at Temple and other universities. We're seeking a total of 300 college students over the next couple of years. The study will be running through 2027, and college students with significant mental health issues are invited to take part. We welcome you. If you're a student here who might qualify, to complete our online eligibility screener to see if you might be eligible, or to share this with other students who might be interested. And if you're a faculty or staff member or other university representative, we welcome you to share this with your students. We also each semester reach out to faculty to ask if we can give presentations in your classes, brief 5-minute overviews of the study. So if we reach out to you, we'd love to be able to come present to your classes if you're willing and able to do that. I know we're at time. I myself am willing to stay on for an extra minute or so if there are any questions or comments. My colleagues can stay on if they're able to. But we want to thank you all again for being here, for caring about student mental health and wellness. The fact that you're here really means that you care. And just thank you for your time today. I think this has been a great discussion.